Hi everyone, my name is Bianca Caracappa and I am a Senior Research Manager within the Healthcare Service Line at Ipsos, and I'd like to welcome you to our Mental Wellness and Health Technology webinar in partnership with the Consumer Technology Association. My colleague, Katie Phillips, and I worked very closely with CTA on this research, and we are really looking forward to sharing these findings with you all. So for today's agenda, I'll be presenting the key findings from our quantitative research in the US with CTA, which defines current usage of mental health technologies, understanding how consumers are using these virtual care solutions, and identifying the main barriers and opportunities for tech in the mental wellness landscape. I will then be passing it over to Katie Phillips to have a conversation with our panelists, including David Moe, Alyssa Dietz, Alexis Shoemaker, and then we will wrap up with a quick Q&A. If you have any questions, please leave them in the chat and we can address them at the end. So first, you might be thinking, what are mental wellness technologies exactly? These are platforms, apps, and digital support groups that can help consumers and patients to combat common issues such as anxiety, depression, stress, and over time, monitor the progress of their overall mental well-being, all happening at their fingertips from wherever they feel most comfortable. A few examples of these mental health technologies include smartphone apps, wearable connected health products, gaming devices, augmented and virtual reality platforms, and virtual care, as well as online counseling platforms, which became extremely popular during the COVID-19 pandemic. Now, we wanted to provide a few real-life examples of these platforms and apps. We have Cerebral, which treats anxiety, depression, and insomnia through medication and ongoing online care. It is a mental health subscription that provides clients ongoing comprehensive access to online care and medication management for a monthly rate. We have Twill, which is a platform that weaves all sides of healthcare together, shortening the distance between need and care by improving access and rapidly generating distinct products that provide real outcomes for real people. Things like Twill Care, Twill Therapeutics, and Happify work together to seamlessly connect people to the care they need, when they need it, and in the way they want it. We also have Teladoc, which is a high-quality platform that provides healthcare via the web, phone, or mobile device and connects patients with nationally ranked therapists to help manage mental health conditions. And then Sleepio, a smartphone app that was validated in the world's first placebo-controlled clinical trial for digital sleep intervention. This showed 54% reduction in time to fall asleep and 62% fewer awakenings during the nighttime. Now, our research was an online survey conducted in September of 2021 among 1,000 US consumers living with or diagnosed with a mental health condition, including ADHD, depression, bipolar disorder, anxiety, PTSD, or an eating disorder. The full report is available in the public domain for those of you interested in digging further into the full data set. Now, although this was a US case study, these results are consistent with other work we've done across the globe in terms of adoption of these different technologies. Mental wellness is a booming space for the digital health community. It has the most range and most longevity in terms of products, but we do see consistencies and parallels in varying therapy areas. The data I will be sharing with you is representative as to reasons why people are engaging in these solutions globally and across therapeutic areas. Now looking at the future of health tech. What is the ambition of technology in this space, and what does tech want to do moving forward? What can it do for those living with mental health conditions? Well, first, we need to focus on choice and personalization. These specific technology solutions can enable patients to select varying treatments, times, and places that best suit them, thus improving engagement, satisfaction, and compliance. We also have a ways to go in terms of empathy, inclusivity, and diversity. But by increasing access to a greater number and range of HCPs and therapists, patients will be able to connect with someone that fits their specific needs, personality, and demography. Health technologies can also help to reduce burden and delays and improve accessibility and scalability by creating additional touch and care points, which reduces wait times and allows for intermediate support. These technologies also help to allow more people across the globe be heard and helped. We know we're not necessarily there yet and still have a ways to go to hit all of these needs within the mental wellness space, but with the health technologies coming forward, we are starting to move the needle. Access to these solutions and the equity of use of these products is a particular area of focus, and Katie will talk more about this during the panel discussion. Now, diving into the key findings from the research. We asked consumers which health technologies they were aware of, and fitness, mindfulness, and nutrition apps rose to the top, which in part is driven by employee health benefits. Digital health platforms are providing employers with access to their apps and thus pushing usage among employees across the US. Unsurprisingly, telemedicine and online counseling platforms have high awareness, in part due to the need to adapt to these platforms during the COVID-19 pandemic. Although awareness is a bit lower, it is interesting to see gaming and augmented and virtual reality come in as a piece of it. Gaming and AR and VR is a growing area in terms of treatment of mental health disorders, and this key point will link to some insights I will share shortly in terms of gender differences. We then asked consumers which health technologies they were actually using, and of the tech that consumers were aware of, telemedicine was most widely used, followed by smartphone apps, including fitness trackers, productive apps, and mindfulness or meditation apps. Now, turning our attention to the light blue bar, we are up against an issue with dropout rates. Although the smartphone apps are widely used, they're also the ones that have the highest rate of dropping out and no longer using the app. Some of these smartphone apps can be quite temperamental. Consumers download the app, use the free trial, possibly sign up for a few months, and then discontinue use. So keeping the consumer engaged and using the app longer is key. Another key finding here is around the gender differences that I mentioned earlier. We are seeing men diagnosed or living with mental health conditions be significantly more likely to be using these technologies to improve their mental health. One hypothesis is that females are more likely to turn to friends, family, and even therapy to help with their mental health struggles, whereas males feel more comfortable using technology to aid mental health as it's a method that offers privacy and therefore reduces any stigma they may feel discussing it publicly. They may be using those gaming devices to speak with others and improve their overall mental health without the need to go to speak with someone in person. We'll discuss this hypothesis a bit further with our panelists later. We then asked consumers for what reasons would they actually start using the health technologies, and it's really all about the user experience. Consumers are used to a frictionless experience, and it is no different in the mental wellness technology space. Consumers want these platforms to be simple to use and easily accessible. On top of that, a key driver among those living specifically with depression and anxiety is to be able to access the tech at any time and any place. If overwhelming feelings of depression or anxiety arise, they want to be able to pull their phones out and use the platform. The free aspect has also always been a key player in adoption, and this is confirmed with our data. As you can see, consumers are driven to use when there's a free trial available or having the tech be covered by the consumer's insurance, specifically when thinking about telemedicine or online counseling. Now, looking at the other side of the coin, the same attributes that drive consumers to use certain platforms are also stopping them from using others. Some of the biggest barriers to use include cost and logistical issues. Within those logistical issues, confidentiality and privacy concerns become a big player in hindering usage of mental health technologies, specifically for those with more sensitive diagnoses, such as bipolar and PTSD. There was a time where you had to go and physically knock on a door and be seen, and now through the app, you are able to log in and get access more privately. And this feeds into the male piece we discussed earlier, where they're able to get help in private via an app versus going to see someone, thus reducing the overall stigma. There is work to be done here to help consumers feel more comfortable and protected using these apps and platforms and instill confidence that their data is not going to be used elsewhere. Insurance coverage is another key piece here. Although telemedicine and some forms of online counseling are covered by insurance, consumers would love to see the apps be covered by their insurance as well, since it's marketed to help with their mental health. And then finally, difficulty using the platform holds consumers back from usage. As I mentioned previously, consumers want that fantastic user experience and expect these platforms to be easy to use and navigate. They are turning to them to help with their mental health struggles and don't need the additional stress trying to figure out how to use them properly. Now, with all that being said, the future does look bright, with over half of our samples stating they are likely to use health tech in the future. This shows huge potential for this market, but as you have seen from the barriers we have just discussed, there is still some work to be done. And to discuss that further, I'm going to hand it over to Katie, who is going to dig a bit deeper into some of the themes we've already discussed. Katie?
Thanks, Bianca. That's been really helpful and really interesting going through everything you spoke about. I think one thing that I also thought was really important from the study that you didn't speak to just because of time was how fast growing this area is and the potential it has to really help what is quite a burdened system already. But I'd like to invite Alexis, Alyssa, and David to turn on their cameras and join me now. Before we dig into the panel in full, I'd love to walk through a little bit more about your background and your roles at your current companies. So, Alexis, starting with you.
Yeah, thank you. I'm Alexis Shoemaker. I'm a Senior Specialist of Technology and Standards at the Consumer Technology Association. I have a Master of Science in Research Administration with a focus on International Research Program Management. My research background specifically is in consumer technology market research. In that space, I really specialize in health tech, AI, and actually managed the mental wellness research that Bianca just shared with us from a programmatic standpoint. Before that, I studied the impact of the cultural impact of tech on specifically self-driving cars. So.
And David, can you take us through your role?
Yeah, thank you, Katie, and thanks for having me. David Moe, Chief Executive Officer here at Cerebral. We're a telehealth company for mental health. I'm a psychiatrist by training and a data scientist, and very, very interested in figuring out how can we use data to better inform care. Did a postdoc in how we can predict and prevent suicidal behaviors, and then ran a couple of companies in the telepsychiatry space. So very, very excited about this conversation. I think it's very timely and very important.
I couldn't agree more. I think you're right. And Alyssa, last but not least.
Thanks so much again for having us. Hi, my name is Alyssa Dietz. I'm a clinical psychologist by background and training. My current role is Senior Director of Precision Care Strategy at TWIL, formerly Happify Health. And in my previous life, I was a professor of psychology. I trained therapists, directed a research lab that focused on the intersection of technology and mental health, and made my way to the digital therapeutics industry about 4 years ago. So delighted to talk about this topic today.
Good. I'm glad to have you all here today. I realized I got too excited to introduce you all. I forgot to introduce myself. So I am Katie Phillips. I am a research manager at Ipsos, and I am a strong advocate for all things mental health and mental well-being, and am a mental health first aider. So before we get started with looking at the data that Bianca has taken us through and go into that in a little bit more detail, Alexis, I kind of wanted to invite you to the stage to talk about the one piece of insight or information that we at Ipsos presented you with that you thought was most pertinent to talk to your CTA members about.
Absolutely. So I was really excited to tell our members about the opportunity for industry collaboration and really the guiding principles for mental wellness tech. So at CTA, we bring consumer tech companies together to face a lot of really important and pressing issues when it comes to tech and innovation and moving tech and innovation forward. So for mental wellness tech, this really involved bringing key stakeholders together to drive meaningful and long-term commitment. And so when I talk about stakeholders, I'm talking about healthcare providers and psychologists, tech companies, UX designers, insurance companies and employers, government authorities, and also academia. So really for us, collaboration means improved consumer experiences and outcomes. So additionally, obviously this tech space has grown immensely over the past few years, and consumers are starting to really take health into their own hands. And so a lot of our member companies were very excited to learn about some more specific a roadmap for mental wellness tech, if you will. So bringing CTA's goal of collaboration and innovation and the current health tech landscape, bringing that together into more actionable insights. So specifically, encouraging companies to gather and communicate evidence and meaningful metrics in order to drive adoption. Bianca let us know that the consumers are ripe to adopt this technology. They're excited to do so. So those meaningful metrics are important for that, taking advantage of that. Establishing quality frameworks to monitor and standardize the quality of care, and overcoming issues in current in-person care, including how mental wellness tech can address high dropout rates. Beyond that roadmap, our members were also really thrilled to learn that the research provided specific focus areas, so guiding principles that mental wellness tech really can and should address to accomplish this meaningful development. So these include relentlessly user-centric design. So design reflects a really deep understanding of individual patient needs and really always centers on the patient experience and also the practitioner experience. Quality in design and care. So really ensuring that all perspectives, including patients and clinicians, are taken into account and lived experience are included in the design of the tech and clinical care. Measuring those meaningful outcomes, as I mentioned earlier, so tracking and benchmarking effectiveness by using randomized clinical trials with measurable endpoints, and also monitoring security and privacy. Clinical involvement and support, so bringing clinicians into the design stage. This technology is meant to really help them and bolster their own practice and allow them to help more people. So making sure that they're involved and empowered and really believe in the product. And then finally, delivering a great experience. So creating consistent experiences with a really transparent feedback loop and allowing continuous involvement for the platform and the care offering. So those were some, I know, more than one insight, but I think that our members are really excited to hear about how they could work together and then more specifically how we could break it down into actionable steps.
I think that was the key thing that came from the stakeholder interview portion of the study, was just how important it was for the technology companies to be speaking to the healthcare industry, but also to be speaking to the government organizations in order to push through what is needed for them. I think maybe before we get on to questions that kind of cover that and dive into that a bit more, David, I wanted to talk to you a little bit more about telehealth. Obviously, it's increased massively since COVID, and I was wondering, where do you see telehealth right now versus where you'd like to see it in 5-10 years or so?
Yeah, it's a great question. I can tell you a little bit about where telehealth is today through a true story, one of our patients, and then talk about exactly where it's headed. It really is exciting because for the longest time, medicine has always been the patient has to meet the clinician where the clinician is. Go to the office, go sit in a waiting room and wait for the doctor to see you, right? And especially for mental health, that's really twisted in a way because people with depression and anxiety, that's a lot to ask of the patient. So how can we meet patients where they are is what telehealth is doing. So this is a true story. One of our patients gets his therapy and prescriber meetings while he's in his truck. And this was brought up at one point, and we said, "Is this, why is it that you're taking your appointments, through the phone, through a video in your truck?" And he paused for a second, and he said, "Well, I'm not ready to tell my wife and my kids that I'm seeking mental health care, and I don't have a private office at work where I could take this call. And so, please meet me where I am, and I appreciate that you're meeting me where I am." Right. And so that's the type of mentality that we have today, which is, I think, a big step forward, which is that we're meeting patients where they are and getting them the care that they need. And initially, these telehealth companies are also adding another dimension here, which is that we can cater to their preferences, right? So when you're choosing a therapist and you want to choose someone, let's say I want to choose an Asian American therapist who specializes in trauma-informed care, I could get that at much higher frequency because these telehealth platforms have more therapists and more psychiatrists to choose from, right? So that matching algorithm is really, really important today. The ability to measure outcomes is really important because that can be built into these apps much more easily than a typical psychiatry clinic. Now, where is this all headed in a few years? I'm really excited about this because we can give the right level of care based on all of this data that we have. We can give the right level of care at the right time to the right patient. And I think that is super, super unique. So I'll give you one example of how we're just beginning to do that. So for certain patients who are suicidal, thinking about killing themselves or ending their lives, there's actually research to show that if you reach out to those patients, if the clinician reaches out to those patients in between visits, not during an extra visit, and calls and just checks in on them, doesn't ask about medications, doesn't pressure them to, hey, we need to follow up. It's just checking in, letting you know that I'm always here if you need me. That actually can reduce suicide attempts, reduce the risk of suicide attempts. We know that in research, right? But it hasn't been scaled. So now, because we have telehealth platforms, what Cerebral has been able to do is figure out who those patients are and then pay our clinicians more and say, look, if you just give them a call, we'll pay you more. It's better for the patient, it's better for you, right? So you might say, well, why didn't we do this beforehand? Well, the reason is we didn't have the data. You couldn't figure out of some hundreds of patients who exactly is at risk. Well, now we have that data, and now we can begin to be more proactive. And I think that's just the beginning, because if you take 5 years from now, if you have depression, right, mental health comes and goes. Maybe you need to see your therapist weekly for a while, and then spring is here, you don't need to see them, but then now it's winter again and you need to see them again. We again need to meet the patient where they are and be able to fit within their lives, instead of saying that, okay, you need to see me weekly, you need to see me monthly, ad infinitum, right? So that's a brief summary of where I think a few of the dimensions of teletherapy would go in the coming years.
That's really interesting, and it definitely speaks to my life. I do see my friends going through cycles like that and needing help at specific times and relying on their doctors and their clinicians to come forward and step into that. I think another area that we spoke about in our interview, Alyssa, was the potential future of digital therapeutics. It's a phrase that actually isn't that well known at the moment, especially amongst consumers, but our digital doctor survey also tells us that many physicians don't know what it is either. I was wondering if you could introduce us to the concept and what makes it so important for our future.
Sure. So the general concept is, I think, best defined by the Digital Therapeutics Alliance, which is a professional organization that works with several digital therapeutics companies to get alignment. Essentially, what we're saying for a digital therapeutic, the sort of high-level summary, is that it's some sort of intervention or a set of activities or some other program that's delivered digitally that either manages, addresses, or prevents symptoms or a specific disorder. And so the range is wide. I would say that many, maybe most of the digital therapeutics on the market currently deal with mental health or behavioral health, but there's also digital therapeutics in things like cardiometabolic health, physiotherapy style interventions as well. So the use cases are diverse, but I think the early sort of adopters and emergers do seem to be around behavioral health specifically.
Thank you. Yeah, that makes a lot of sense. It's useful to hear such a clear definition for that. And David, maybe if I go back to your patient example, the man in his truck needing healthcare there, I think it shows how important access is, and it also shows the need for insurance. But what we see with a lot of telehealth, but also digital therapeutics, is that many insurance companies aren't covering it, and there are also big policy constraints in the US. Where do you and Cerebral kind of go to challenge this? What are you doing in order to tackle that?
Yeah, great question, Katie. If it can't afford it, right, then there's certainly some people who can't afford the direct-to-consumer price, and then there are others who can't, or they prefer to use their insurance. So how do we do that? So we are covered in tens of millions of lives across the U.S., and we do something quite unique, and we understand where the insurance company is coming from. They're saying, well, show us that this is just as good, if not better, than standard of care, right? Than brick and mortar care, right? Well, then the onus is on us as telehealth providers to do that. And that's exactly what we provide. So on a monthly basis with our insurance partners, we actually give them a report on their members, on their patients. And it has exactly how long do they have to wait to get care. It's always single digit days, 3 to 5 days typically. How are they doing? What is their diagnosis? What are their differences in their depression scores, the PHQ-9 or the G87 for anxiety disorders? When people leave the service, why are they leaving, and what percentage of them are getting better? And that's the reason why they're leaving the service, right? So they want that data back. And so this comes back to, we have to show the value of telehealth. And that is what incentivizes the insurance companies to really say, okay, well, then we should treat it similarly to brick and mortar care, right? So I think that's a really important thing, giving that information back.
Yeah, I couldn't agree more. And I can see why it would be helpful to an insurance company to get that. And Alyssa, I can see you nodding your head too. Clearly is something you agree with. But are there any other access to care issues you can think of? Obviously, we've touched on insurance, but there must be others.
Yeah, absolutely. One thing that I think is really interesting is that folks assume that people who are going to adopt digital methods are going to be like 18 to 30-year-old people who are, sort of heavy tech users, but that's not borne out in the data. And I know that's at least some of the information that was presented in the report, that really we see use cases across a whole spectrum of ages. And so, that provides access and ability to get care for folks who maybe otherwise wouldn't be able to. Maybe it's an older adult who stopped driving and finds it difficult to arrange an appointment to get to the hospital and find parking and walk all the way in the bowels of the hospital to find their provider. So I think that's one thing that's important to note, is this age range of folks who use digital products or use it to access telehealth services, such as telemedicine. The other thing that I'd like to point out too is that I think there's a quick assumption that only sort of those in the wealthier socioeconomic statuses have access to digital care, and that also hasn't borne out in the data either. I know Deloitte published a report somewhere around, I think it was about 80% of folks who receive Medicaid in the United States have access to a digital device, whether that's a cell phone or a tablet, and have at least intermittent access to an internet connection. And so I think that's something else that helps, again, to improve access. There's folks who live far out in rural areas, and it's hours to the closest healthcare provider. And of course, I'm going to do a little plug on mental health. I saw something that 60% of counties in the US don't have a single psychiatrist within them. And so those folks being able to access high quality care is really an important access piece that I think maybe we don't talk about enough.
Yeah, absolutely. And it's something we see in the UK as well. Alexis, I was wondering if you could bring in any examples outside of healthcare as well, because we must be seeing it in a broader sector too.
Absolutely. So I think, it's been touched on before, but a major key in understanding all of this is the interplay of mental and physical health. So in a lot of ways, mental wellness tech and health tech in general is really highlighting this holistic perspective on health and well-being. And so when we're talking about access to care, obviously there's the socioeconomic and regional differences, but we're also talking about every stage of the patient journey. So pre-symptom and prevention, designing tech that's really providing support before it's needed, which is helping patients help themselves, which is something that we see them wanting to do in the first place. And this tech is really meeting them where they're at, as David had said that we should do. Symptom onset, so the technology being used to log symptoms and spot early warning signs, so kind of early warning bells for abnormalities, prompting patients to seek care. Also diagnosis and wait times. So technology is really enabling point of care diagnosis and speeds up the patient journey. So immediately after diagnosis, this tech can be used to bridge gaps and wait times for in-person psychological support if needed. And then also treatment cycles. So apps and systems being used to help with patient compliance, logging outcomes, and also keeping the patient in closer contact with healthcare providers. I think a lot of folks will just go see their doctor or their psychiatrist or whatever their support team is. They'll go see them and think that that problem is now gone and fixed. But it's nice to keep that constant contact with the support team. And then also for post-treatment. So after treatment has ended, tech can help patients keep in touch with their healthcare providers and offer emergency care to allow for better integration and different needs with other conditions. So this is, again, this holistic piece here. So I think that's one side of the access to care coin. We have chatted previously about increasing accessibility and inclusivity, reducing those wait times so that access to care on someone's own time if they're unbound by business hours, and then also providing support that reflects a larger group of people. So David mentioned this earlier. We see that a lot of psychologists and counselors are not necessarily as diverse as the patients that they treat. So this creates empathy gaps, and I think tech can really fill this space. And then also, gaining a more representative group of healthcare providers when it comes to lived experiences. And then also, growing access to care means offering tailored solutions to suit patient needs. So offering lots of different options for patients to choose between, rather than that one-size-fits-all approach that we've kind of seen in more traditional healthcare. And then finally, we're just keep driving it home over and over again, but I really think the increased access to rural and low-income and hard-to-reach areas it's a space where this tech can really grow. It just absolutely, it really highlights where this tech can be used. So like increasing the number of people who have access to mental wellness. And like Alexis said, we're not necessarily seeing that the tech is able to serve many different socioeconomic tiers. So we're not just seeing that it's only one tier that's being served by this technology.
Yeah, definitely. And it's something that we at Ipsos talk quite a lot about, this equity and the need to make sure that people from a broad range of areas and different socioeconomic groups have access to the care that they need and that they deserve, and also in ensuring that their insurance, for example, is covering it too. I think the other thing that you touched on, Alexis, Alyssa, that I wanted to ask you about was the idea of care not being one size fits all. I know obviously our personal lives are so highly personalized. We get loads of different emails addressed to us every day. And that's something that people are begging for in their care, and it's trickling into well-being too. How does TWIL address that?
Yeah, absolutely. I'm so glad that you asked, because that has really been a focus of TWIL's as we've pivoted from being sort of a wellness point solution to offering what we call sequences. And so sequences are a series of care products and services that are organized around a specific condition. And for example, we have one in mental well-being. And so we have products that span the wellness space, right? Manage stress, sleep better, improve your mood, manage worries, all the way up to FDA regulated, currently in trial, prescription digital therapeutics, which treat major depressive disorder and generalized anxiety disorder. And so what we're able to do is tailor the level of care that a person receives based on their needs, but also their desires. What do they want? What are they looking for? And so these digital assets are paired with human coaches and will in the near future be paired with human teletherapists and human telepsychiatrists, so that we can really help people get access to care that makes sense for them and their circumstances and their needs. We also use a machine learning process to tailor those interventions. So we learn quite a bit about the individual, what their dog's name is, what brings them joy. Maybe they like running. I can't understand that, but for some people that is true. And then tailors the information that they receive to their specific interests, life circumstances, etc. And I think something that Alexis brought up earlier, this one size fits all thing, I think it was okay at first when we were trying to do a proof of concept that, we can do this, we can help people live better, healthier lives via tech. But now that we've established that, we need to get really serious about personalizing what people see and what they're delivered up so that it makes sense for them.
And I know, David, you briefly spoke about this too, right, in terms of matching your therapists up with people who match their backgrounds, their ethnicities. Is there anything that Cerebral also does that kind of helps to address this too?
Yeah, I might add here that certainly addressing patients' preferences is really important in mental health specifically. It also helps with specialties as well. So, certain prescribers and therapists specialize in a specific type of therapy, whether it's CBT or DBT. And for prescribers, it could be there are groups that get treatment for bipolar disorder or have extra training for, let's say, eating disorders and whatnot. So, as an example of that, when you come on, if you're a prescriber and you're a psychiatrist, let's say you come on to Cerebral's platform and you want to treat patients here, there's a mandatory bipolar training that you have to go through. And you can't see bipolar patients until you go through that, right? So, and then now if you're a patient coming in and you get screened positive for potential bipolar disorder, you only get matched to a clinician that would be able to treat that, right? So the idea here is that there's a quality control here that is very unique about telehealth as well. And this is something that we just don't have today in the status quo. And I think this is really important, always understanding what we're comparing the teleservices to today. I'm a psychiatrist. I could go to any clinic right now, apply for a job. They're not going to test whether I know the treatment algorithms for bipolar disorder or the standard of care for PTSD. They're going to assume that because I have a degree, that I can just do that, right? And so I actually think telehealth can also help us tailor and better steer patients to clinicians that can help them the most, right? So it's not just getting that preference right up front, but it's also driving higher quality care at the end of the day for patients at large.
I love the sound. I also love the idea that it's not just about improving the lives of the patients, it's also about improving the lives of the physicians and ensuring that they can offer the best care and that they're getting the right patients for them. It's great to see it kind of is quite symbiotic in that way. And I guess maybe this is an interesting question for both of you, David and Alyssa, but obviously you've both come from clinical backgrounds and you're both practitioners yourselves. How do you feel about the idea that this technology is kind of in some way replacing the human touch? What would you say to that question? David, do you want to answer?
I love this topic.
Yeah, go ahead, Alyssa. You could go first. I'll go.
Oh, I'm sorry. I didn't mean to take that, but yeah. So thank you. What I think is really the most important thing to highlight is there is a crushing demand for mental health care services. We have nowhere near the supply, and we are never going to meet that supply. There is no way to train up enough humans to meet at the paces that we are now, or even could potentially stretch to. We're never going to be able to meet those needs. And even still, those hardships persist for getting access to care, right? Telehealth certainly ameliorates many of the challenges, but not all of them. You know, there was this gentleman who did have a truck that he was able to go into, but there are others who maybe have similar circumstances and can't and need to access maybe something like digital therapeutics on their own time, at their own pace. And so the way I really think about this is that these products and services are part of a stepped system, right? We're not replacing humans. What we're doing is we're optimizing the human resource match with the patient needs so that we're better able to serve everybody. Instead of having all these people on a don't call us, we'll call you list, we're able to get people immediate care. And we're able to get people who would do well and would benefit from sort of self-guided digital interventions. We're able to get them the care they need while freeing up that human resource space for those who are more acute or definitely need the human intervention.
Yeah, I agree with that, Alyssa, that, access is really important. Step care is always really important. The way I think about this is that, as a psychiatrist, it's very difficult to replicate the therapeutic alliance. It's much easier to augment it and to make it more efficient and to empower clinicians with the right data so that they can provide really high quality care efficiently as well. So they're not scheduling it. So what do we do to allow our clinicians at Cerebral do that? We make sure that any logistical work we try to take away from them as much as possible. So scheduling appointments, rescheduling appointments, things along those lines, we try to take it off their plates as much as possible so they can spend more time with their patients as much as possible, right? So when it comes down to validated surveys, those clinical surveys I talked about, we encourage our clinicians to fill it out, our patients to fill out beforehand, so that the patient and the clinician can spend time talking about other things as well, right? So I think a lot of this is about empowering clinicians with data and to drive not only higher quality care, but also more efficient care. And that translates to a higher effective pay for the clinician, and that translates to a happier clinician and more people going into the field, right? So I have no doubt that in X number of years, we're going to have more fancy AI and things that may replace humans. I don't know how far that is in the future. I know for right now, it's all about how can we make the clinician feel empowered with care. And maybe one last thing I'll mention here is that so often clinicians have to, when there's a complex case they're looking at, they look up the guidelines, they look up their old textbooks and notes and things to understand where things are. We make that really easy because we actually pay for up-to-date guidelines. It's a service, and literally one click out of the EMR, they can find those guidelines immediately. If they want to talk to a second opinion, we actually have a second opinion line that's staffed by licensed psychiatrists 12 hours a day, 7 days a week, right? So they can just, within a few minutes, get in touch with another psychiatrist for a second opinion. And the idea here is to make it as simple as possible for our clinicians to provide high quality care, make them more efficient so they can see more patients. So that's the general idea today.
Thank you. I think we've got a follow-up question to some of the things you were discussing, David. Perhaps you've already covered some of it, but do we have any more information in terms of the treatment effects about in-person cognitive behavioral therapy versus when a person does it in a telehealth setting?
Yeah, and Alyssa would be an expert on this as well. So all of the research, when you look at the meta-analyses, when they look at all of the different studies put together, would demonstrate that telehealth for therapy is just as effective as in-person care. And that's not true for any other field of medicine other than psychiatry. And it kind of makes sense because there is no physical exam here, right? So that may not be true for, let's say, primary care or other types of medicine. But for psychiatry, it really is, in mental health in general, in therapy, it's really about that relationship. And the evidence has overwhelmingly shown that the two are equivalent in effect size.
It's really interesting to hear that.
If I could also just add to that, is absolutely accurate. And additionally, there's been studies to look at whether digitally delivered, not by a human, but digitally delivered CBT is as effective as delivered by a human. And in most cases, I know of at least about 8 papers show that it's at least as good. And worst case scenario, some designs are looking at non-inferiority, meaning it's no worse, right, than face-to-face therapy, either via tele or in-person human-led care. Yeah, I can't.
Katie, you might be on mute.
Sorry, I was on mute. Sorry about that. You think you'd be over that by now. We've only got a couple of minutes left, so I've got one question that I think our audience might want to hear, and I was going to ask it round robin to everybody. But if we get digital well-being right, if we get the technology right, what would you consider the ultimate benefit to the patient, HCP, or the sector more broadly? So Alexis, I'll come to you first for this.
Yeah, so as a representative of the consumer technology industry, I'll take the sector focus. So for the sector more broadly, I really believe that the biggest benefit would be demonstrating that we can all work together to make widespread and positive impact. So that's really seeing industry collaboration I touched on before between all of those different players, HCPs, tech companies, insurance companies, government authorities, et cetera, with the ultimate goal of improving lives and really helping people. So really it all boils down to showing the exciting possibility of widespread commitment to altruistic collaboration, putting the consumers and their wellness first. And I think that that would be really inspiring to see.
Yeah, I agree. I do think it is all about putting the consumer first, isn't it? And David, what have you got to say?
Yeah, I think it helps every stakeholder here. So for the patient, that means more timely care and better tailored care and more convenient and accessible care immediately. For the clinicians, it means that you're better empowered to provide higher quality care. You're having all these tools at your fingertips. You're getting access to data about this patient that you otherwise had to ask in person. And I think very importantly for the insurance companies and for Medicare and Medicaid, this is also really important as well, because when you provide better care, higher quality care, you can actually prevent unnecessary hospitalizations, emergency room visits going forward. So one last thing I'll say here is that we've been able to show that a lot of patients with panic attacks go to the emergency room when they don't have anything else to go to, and that costs thousands of dollars. It's a bad experience for the patient. Their clinician doesn't even know about it, right? If we can prevent that, that helps all stakeholders here. So I think all stakeholders win if we can get digital health and telehealth right.
Yeah, I love the sound of that win-win. Alyssa, last but not least again.
Yes, I wholeheartedly and enthusiastically agree with everything both Alexis and David has said. And I'll also just add that, I became a psychologist because I wanted to help people be empowered to live more healthy and meaningful and happy lives. And I really think if we get this right, if we can all work together and figure out how to deliver this personalized, tailored care along a spectrum from wellness all the way to intervening with people who have clinical levels of disorders, that just makes for a much better world. People are happier, people are living longer lives, and that we're preventing the development of many diseases that reduce life expectancy. And being able to do that has all sorts of downstream effects. You see lower rates of, like interpersonal violence, crime, all kinds of things that can be downstream from people who are feeling like their needs are being met, who are, given tools to improve their daily lives and functioning and well-being. And so I think that the promise is so big, it's so exciting. I know that we can do it. There's just a few major problems we need to tinker with and get ironed out in the meantime. But I've never worked with more committed, more passionate people in this industry. And I think we're all gonna pitch in, roll up our sleeves, and figure out how we can do it.
Yeah, I couldn't agree more. Everybody that we spoke to when using the stakeholders for these studies and the various people that Alexis introduced us to, it did really show just how passionate people are about this area and how much they want to strive to push it and strive to make sure that patients and doctors, and I guess the sector more broadly, gets exactly what they need from it. So I think that's us and our time today. I just wanted to thank our lovely 3 panelists for all of their time and their really insightful answers, and also my colleague Bianca for taking us through the initial part of the survey. Brilliant. Thank you, everyone.
Thank you so much. Bye. Thanks.
Thank you.